Guys, it's Dr. Goggin. You can call me Sunny. And today I wanted to talk quickly about how can you tell if you might be toxic from mercury. All right, it's not something you think about too much, but you remember the Mad Hatter back from that. Remember the Mad Hatter, right? He was a hatter by trade, and he had gone a little crazy because of the mercury involved in making the felting of hats. So when in the olden days, when they used to produce felted wool hats, they would uh, use animal furs, and it was treated with a solution of mercuric nitrate that roughened the fibers, and it made the fibers mat together. Now, when I think about this, I think about the mercurochrome I put on all my cuts when I was a kid, right? That orange stuff you put on cuts when you were a kid. Yes, it had mercury in it. Oh my gosh. Well, what they noticed is that hatters started to have tremors. They were originally called the hatter's shakes. They started to have mood swings, irritability, depression, memory loss, fatigue, abdominal problems, loss of appetite, and muscle weakness. And severe cases could go on to kidney damage, respiratory failure, and death. And so the big problem was nobody knew that people were toxic from mercury, and now they made a lot of new regulations, so people are not using mercury in that same way. But now we have to be careful about getting it because we can actually get it from fish, right? So that's what I want to talk about. Could you be a little bit toxic from mercury? And what are the signs and symptoms of mercury poisoning? How would you know? So first off, fatigue, feeling tired, feeling irritable, headaches, a little bit of muscle weakness. Now, if you were exposed to a really big slug of mercury, you might actually have coughing, difficulty breathing, and chest pain, and a whole bunch of stomach issues like nausea, vomiting, diarrhea. You might have a fast heart rate or blood pressure. You might taste metallic taste in the mouth or have problems with your vision. It's also important to say right now that amalgam fillings have mercury in them. And guys, you should not get amalgam fillings in your mouth. And if you have amalgam fillings, you should slowly have them removed in a safe way, okay? It's really important that you take a binder that will bind any excess exposure when you get your amalgams removed. Swish around some chlorella before, make sure that you have nasal oxygen, that you're going to be breathing through your nose, not through your mouth as they're drilling the amalgams out, because amalgams have mercury in them. And this is a big problem. We know there are neurological cognitive effects that come from having mercury. So, what's nice is we can test for this, right? What other things you see? Insomnia, sleep disturbances, those fine shakes or tremor, difficulty concentrating, memory loss, confusion, numbness, like pins and needles in the hands, in the feet, or around the mouth. Mood swings, I mentioned before, nervousness, anxiety, depression, because it affects the nerves, okay? We see people have a decline in cognitive function. It can affect language production, visual spatial abilities, and fine motor skills. I mentioned the kidney damage, all right, and kidney failure in some instances. You can have skin rashes, you can have dermatitis, hair loss, brittle nails, and if you never check for this, you will never know, okay? Gastrointestinal problems, I mentioned before. I mentioned the respiratory difficulties, reproductive problems. Mercury crosses the placenta, and that's why women who are pregnant should not eat tuna. Menstrual irregularities, reproductive problems. So all of that said, what do we do? And how do we not get mercury poisoning? Well, the big thing is to use safe handling of mercury containing products. Who remembers playing with the mercury from a thermometer when they were a kid? I think we did that as a science experiment in school. Seriously. You remember that? And then the main source, guys, is actually fish and seafood. And this is a tricky one because you know me, I'm a big fish eater. I don't eat much red meat. I eat a lot of salmon. And sometimes I wonder, in fact, after talking about this and reading up on this, I'm going to be checking myself for mercury, right? I'm going to make sure that I'm okay because some of those things I've certainly experienced. And you don't know unless you check. We know fish is healthy, but you got to pick the right fish, right? So the most healthy fish are going to be the fatty types of fish, the ones that are high in omega-3 fatty acids. These have been shown to reduce your risk of many diseases. They've been shown to help your brain function better, which is so important. Less heart attacks, stroke, less death from heart disease. And so what kind of fish are safest to eat? Okay, first, what should you avoid because of mercury contamination? Y'all are going to hate this, especially those who like to go out and have a big old fish steak at somewhere out. Okay, high mercury in shark, rays, swordfish, marlin, king mackerel, tilefish, orange roughy, ling, and southern bluefin tuna. Okay, so a lot of those fish are very popular in fancy restaurants, big old swordfish steak. If you eat that, you need to do it rarely to never, rarely to never. And if you are if you're a sushi eater, you need to be checking your mercury levels. If you're a sushi eater and you don't feel well, you need to be checking those mercury levels. So what are safer fish choices? Salmon, particularly wild salmon, sardines, herring, trout, canned light tuna, pollock, catfish, shellfish, lobsters, and oysters. These are they're safer options. Really what you want to be doing is like in terms of the do not eat, don't eat king, mackerel, shark, swordfish, tilefish. Guys, they are very laden with mercury. Oh, so sorry. I know some of you guys love it. And then you want to make sure that there aren't any fish advisories in your area, right? EPA fish advisory online will tell you what you shouldn't eat. And then in moderation, maybe up to 6 ounces per week. That's not a lot, guys. White tuna, local lakes, rivers, coastal area fish. That's eat in moderation. And then, as I mentioned before, it's okay to eat up to 12 ounces a week of fish low in mercury, like wild salmon, canned light tuna, catfish, pollock, shrimp. Now, if you are a big mercury eater, sorry, if you are a sushi eater and you're tired, you're going to want to get your levels checked. Now, I think the best test for this is a quicksilver try test because when you just look at urine mercury or blood mercury, you do not get the full picture. So in a try test, you will be looking at mercury in the hair, in the urine, and in the blood. And then they extrapolate how well are you clearing the mercury in your blood. And they look at inorganic and organic mercury within that test. And so this is the best test for determining if you could be mercury toxic. Quicksilver Scientific has this test. I'm not sure if it's direct to consumer everywhere. I think usually you need a physician to order it for you, but they may have a direct to consumer program. If you go to your doctor and you want to get tested for mercury, they are going to give you a blood test and it doesn't give you the full picture. However, if that is high, that's a huge red flag. Okay, so it's a good idea. I mean, that's a great place to start. And then really moving towards a plant-based whole food diet. We want to get a lot of that good protein from legumes, and we're looking for those legumes that are lower in lectin, like love the lentils, Madras lentils. Ooh, so delicious, right? Okay, guys. Well, I hope that that's been helpful for you. And don't eat too much mercury because it'll make you feel terrible. Okay. See you.